So, welcome to See the Stories, the signature segment of 3-Hour News Show. So today we will talk about Milia, a skin condition that usually happens in infants, but can also be found in adults.
Milia are tiny white-colored facial bumps or cysts that resemble whiteheads. Milia appears when keratin becomes trapped under the outer layer of the skin and form a small cyst.
Although milia commonly appear in infants, they can also occur in adults. Milia usually disappear on its own without any treatment, but can persist in adults, which will take time to remove.
Now, since it's actually on the face, people might have been looking for the way to get rid of it.
Yeah.
But what is the best treatment to treat milia? Let's find out with our dermatovenerologist, Dokter Alfonsus Rendy, Italia. Hello, doctor. Thank you so much.
Hello, Hans.
Hello, doctor.
Welcome back to the
Nice
show.
to see you again.
Thanks for having me.
Yes, it's always a pleasure to have you here because we have lots of questions regarding some issues. Now, first of all, we are talking about milia. Can you elaborate more about milia? Because there are some misconceptions and also misdiagnosed when it comes to milia, when it comes to just commoners like us.
Yep.
Yes. It's very interesting. We're talking about milia, where it's like a lot of cases, especially patients come and ask me, doctor, is this bumps is milia or this is acne or any other bumps that occurs in the skin? So basically milia is the way that you said it before. It's a pile of keratin that trapped under the skin. So our skin have some layers. We have an epidermal, dermal, and then subcutaneous. It's actually trapped in the epidermal layer.
Oh, so the upper layer, the most upper layer.
Yeah, it happens usually when in infants. It happened because it's still developing the skin. The baby was when he or she was still in the wombs. The skin was building up the skin inside the water of the water birth.
Like all the time in the water, like
all the water all
it.
the time. So when they get birth, they developing the skin and shocks to the surrounding atmosphere. That is why happens. There is a milia. So if you have a baby and then your baby have a milia, don't panic. That's actually a normal things to happen in baby, especially in 25 days after they born. But in adults, it happens usually because there's an injury or damage in the skin. That's why there's inflammations under there. And now what makes the dead skin of what you called as the keratin comes up and piles up in those sac where they call it as a cyst, right?
Yeah.
Cyst is actually a Latin words for chamber. So there's a room that have no exit. They don't have any port to exit. That is why the pile is trapped in there and we have to take it out.
So that's why probably milia, it's not like the whiteheads that you used to see, which has a, what do you call it, the outlet or the pore?
The point of exit.
Like the pore to have it extracted.
Yeah, you're right, because milia is shaped actually not in the hair follicle. Acne is shaped in the hair follicle. So every sebaceous gland comes out in the hair follicle, and then the oil was pumped up through that hair, and one thing's going on, there's a pluck in there, then happens a comedo, and then the acne, and then cystic acne. That is why if you see the comedo, there's a white head and a black head.
Yeah,
that is because there's a pores in there, and you can see that the oil or the sebum is trying to come out. But milia doesn't work that way. It's like a room without no doors.
So, I see, like there's no point of exit.
Yeah, there's no point of exit. Yeah, it was just trapped in there, and then the colors become whitish. That is why some of us call it milk spots.
Now that leads to the next question, Doc, because you were saying about 3 different things. So what separates milia from acne and cystic acne?
Oh, okay, that's very interesting questions. First of all, from the cause of it, the milia happens usually in the eccrine gland or only in below the skin in the epidermal tissues. Acne happens in the hair follicle. That is why, first of all, milia doesn't have any port of exit.
Yeah.
And acne have a port of exit. I see. And then acne, we can classified is as a comedo acne and a cystic acne.
And what is cystic acne?
Komedo is a silent conditions without any inflammations.
Usually without pain at all.
So usually without pain, but you see it, usually you can see it in your nose, like dark spots like that. And we call it a black
Under your
dot.
So
lips,
familiar,
yeah.
so familiar.
Right? So if it's white, we call it as a white head. If it's black, we call it
Dark,
a black head. It's becoming black because there is oxidation process with the oxygen surrounding us. That's why it's becoming black. But actually, it's supposed to be white
Okay.
because it's contained a sebum. And then after that, after they plucked, getting more severe in the plugging conditions, they become inflamed. And when they inflame, they invite the bacteria there, especially the Corynebacterium of acne, and that makes happen the cystic acne. So if you know you hold the acne, it becomes very inflamed.
Swollen and red.
And swollen and red. And when you put your hands in your skin, don't put that every day, please.
Do not touch your acne.
You not don't. I just touch my face. It's okay.
But Doc,
Expressions.
I'm curious because Milia doesn't have a point of exit. So does skin tag. What's the difference between Milia and skin tag?
That's very interesting. Skin tag is actually a benign neoplasia. So it's actually a tumor, a benign one, never cancers. It's 94% is benign. That happens usually in the face also, in here. Sometimes, you know, like the more older person, you have some skin tag in here. Also in the axilla and also in the thigh. It happens due to the reactive oxidation or reactive oxygen species that happens to your skin and make a benign tumor. That's different pathogenesis.
So one is tumor, one is milk spot.
One is milk spot.
Okay, so it's another day to have a discussion,
About the skin tag. But
so when it comes to Milia, does it grow bigger or does it expand?
So here's the thing. There's of course there's a mild one, there's a moderate and a severe kind of Milia.
Oh my God!
Right.
Hold my hands.
So if you still have a mild one, usually using the exfoliating agent, like an exfoliating toner, you're using your exfoliating cream, hyaluronic acid, you're using the salicylic acid, beta hydroxy acid, anything with acid, you can just make it fade away during the times, or even it's going to be gone in times because you clean your face even better.
Yeah, even without treatment, I had it and it's gone.
It's gone.
Like for 2 months or so.
Yeah, so there's if it's a mild one, you can clean it by yourself or you use your daily exfoliation routine, then it's gone. But if it's already being moderate or severe one, the cysts were sometimes really, solid.
And persistent.
So the wall, like I always talk to my patients, cyst is chamber. Cyst is like a room. When the room is piled up during times, get the sun damaged by then.
It's trapped there.
So it's trapped there, and you can just let it out by using the exfoliation cream or toner. Of course, you need to go to the expertise, like me, dermatovenerologist and aesthetics, and do some treatments, usually to take it out.
What are the common causes of Milia, Doc? Because we see it in our everyday lives, right? Like I had it, maybe you did. And is there any specific skin type that is more prone to have it?
Yeah.
So first of all, Milia there's two kind of things: a primary Milia and secondary Milia. Primary means there's a certain conditions in your skin causing the Milia. For example, like the baby that I said to you before, 25 days after they born, they're still developing with the skin, and then happens to be Milia. And also there's congenital diseases that related to Milia. So when a baby or kid more than 25 days having a lot of Milia, probably you should suggest to go to the dermatovenerologist and aesthetic because some syndromes were related to that. I mentioned some like porphyria cutaneous tarda, epidermolysis bullosa. It's very, it's very rare diseases, but it's related to that.
But it can happen.
That happens to primary Milia. That's one of the symptoms, okay? Not all the symptoms is Milia. The other things is secondary Milia. That's happened to all of us. Sun damage, when you go to, you go to the office in your daily activity, you don't use the sunscreen, there's a damage in there. Like I said, the sac happened due to the damage and inflammations below your skin. However, the sun is very interesting. They can damage your skin without making blisters in your skin, right? That is why this one is intact, and then the sun damage happens here. There's an inflammation here. The keratin piles up. That happens. There's a milia.
Oh.
So the damage in your skin may happen due to improper treatment of the skin. If using too much of corticosteroid creams also can occur.
Wait, what is that? Corticosteroid treatment?
Corticosteroid creams is, it's not actually an over-the-counter medicine.
Okay.
Creams,
All right.
but you can see that usually they have the word sun behind it.
Oh, like
with S-O-N.
Blah, blah,
like
blah.
betametasol.
Yeah.
Oh,
It's
okay.
actually not a brand, so it's okay. Betamethasone, desoxymetasone. It's actually you can use it for your skin, but if you use it too much,
Even for eczema.
but if you use it too much and without any proper,
Dose.
so that can make happens the milia.
Okay, so sun, and then the steroid.
The steroid, and then the NSAID.
What is that?
NSAID is
Type of medicine.
you like sports, right?
Yeah,
Sometimes
I do.
when you do the sports, you feel like pain in your hands, and you're using the natrium diclofenac creams.
like a-
Even it's rarely we using that, but be careful. Milia, it's actually can occur also in your trunk, in your genitals also, and in your face.
Oh, wow.
It's like kind of painkiller, right?
Yeah, it's kind of
Diclofenac, like
painkiller.
Cataflam. Yeah, it's a brand, sorry.
Yeah, that ointment or that creams makes a small injury in there and make also prone to milia.
But what about diet, doc? Does
That's-
sugar also cause milia?
That's a very interesting question, and then probably the most controversy topic.
Sugar and dairy, maybe.
Yeah, but in my reading to the literature, they said that high sugar conditions, if you check your blood sugars and there's a peak on it, there's happened to process that we call as a glycation in the skin.
Yeah.
Blame the glycations. But no, this is really, glycations actually more related to the one that you said as a skin tech.
Oh, okay.
Skin tech happens mostly because of glycation process. That is why people with diabetes is more prone to have the skin tech.
Oh, okay.
But
Or
milia-
people with obesity.
Yes,
Like after a pregnancy,
after
weight
pregnancy,
gain,
weight gain.
very rapid, and then skin tech, and then it's gone.
That's really right, Maria. A lot of readings, good.
You don't mess with mothers. Mothers would actually read a lot.
They will read
Anything.
They will read all of their knowing skills and ask me in those 30
like-
minutes.
But okay,
That's good.
Serious.
so probably I'm quite clueless compared to Maria. But is there any skincare ingredient that people prone to milia that we should avoid?
Oh, okay. The other things, I'm not yet finished with the
Oh, yeah,
one it's okay. There's two things. When you get aging, it get more risk to get a milia. And also the last thing, if you don't clean your face thoroughly, like you don't do double cleansing, probably you're using makeup and then you sleep.
Yeah.
In the middle of it, probably like you guys
I
are
did-
very
yeah,
busy.
yeah,
Sometimes you use makeup, you sleep because in the morning you need to get.
Guilty as charged.
You just do the touch-up.
Yeah,
That's
yeah.
actually can problem with milia. So don't do it very often, guys. Please.
Okay.
Okay.
So it's only that. I mean, we have to clean our face thoroughly.
Yeah, double
But
cleansing.
there's no other ingredients in any skincare product that people who are prone to milia should avoid.
Yeah, there are some ingredients that you should avoid if you have prone to milia. First of all, a rich creams like a balm, like an oil. You can
Like hydrating.
oil-based,
Oil. Yeah, I
usually
see.
oil-based or even petrolatum-based. So the more thick is, it's have a higher risk to block your pores and any layers of your skin. So the keratin trapped in there and makes happens, the milias happen. So,
So
for
it's better
example,
cream-based than oil-based.
Yeah, so it's better the water-based.
Or even
Oh,
the
yeah,
water-based.
like the not really thick base.
Yeah, right. So some people using the balm cleanser, right? Some research said that the balm cleanser is actually also causing milia in some patients. So it's okay. It's not like I doing the black campaign for the balm. Everyone is going to angry at me.
Yeah.
It's okay using the balm cleanser, but probably in once or twice every week, you need to cleanse it with an oil-based cleanser.
Okay.
So to make sure, or the petrolatum, so the balm is made from the Vaseline alba or the Cera alba. Cera alba is a protein comes from the lamb. Vaseline alba is actually also some proteins that can moist your skin. It's easily trapped in your skin and can causing milia in people with prone to milia.
All right.
see.
You actually relieved me over there because I used
You didn't use the balm.
No, I do clean my face with balm
Oh,
cleanser
okay.
every single day after the show because it kind of like getting rid of all the makeup.
Yeah, it's very
faster,
fast, right?
Yeah,
very
very
fast.
fast.
And it's not drip everywhere.
No,
because
it's
it's
not.
balm,
Yeah,
right?
it's pretty neat.
So you can just use it in the cars and everything. But
Yeah.
please mind to use the oil or water-based once or twice to make sure that there's no debris that causing the
Yep.
milia.
I see. And you have mentioned that we should never pop a milia. But what would happen if we accidentally thought it was a cyst and we popped it?
Pop it. So actually, in what was that? What's the social media? I lost in my head. TikTok.
TikTok.
It's okay, right? I mentioned
sure.
It's
TikTok.
okay, it's okay, it's okay. It's okay.
So in TikTok is like very viral, people popping out the milia.
Oh, no.
But however, you should know, we don't know whether the milia is the mild one, is the moderate or severe one. If it's a mild one, it's going to pop up really easily, like the one in the TikTok that I share. But however, if you have the mild or moderate, where the piles of the cyst is already shaped, it may not comes out first, and second, it may causing the damage, which is going to make the milia even more bigger. And the third one, it's going to causing the inflammations that probably form the scars or the dark patches in your faces. So it's better if you
Breaking your skin.
yeah. So if you're using the exfoliating-based cream or active agent and the milia is not going out, probably better you go to the experts.
Doctor. I see.
Doctors. Yeah.
Okay, now, because you were mentioning as well that milia could actually occur in other parts of the body. So what can we do to actually, or how to treat milia per se? Because we haven't talked about it, like how to properly treat milia.
Milia.
Should we go find a particular product to help us getting rid of the milia, or there is a certain treatment for that?
So that's a good question. First of all, I like my patients knows about their skin. That is why, like Maria says about this and that, I like it very much. So probably all of the See Today viewers, as already know, there are some agent to kicks out milia, right? The one that can kicks out milia is, first one is the preventive one. The preventive one is like the cleansing, oil cleansing toner that you can use to make sure that there's nothing trapped in your skin. The second one, if milia is already formed, you must know that you can use exfoliating agent or active agent.
Okay.
The key to active agent is usually have an acid in the,
Oh.
in the last name of
Yeah,
it.
yeah,
so
yeah.
like salicylic acid,
Hyaluronic acid.
Glycolic acid.
Glycolic acid.
I need to fix that a little bit, sorry, but
Yeah.
hyaluronic acid is actually classified as a moisturizer. So even if have an acid, it's out.
not
Moisturizing
effective.
agent.
Okay,
Because
okay,
it's a
okay.
moisturizing agent, it's take out waters from the atmosphere, makes
Yeah.
your skin more moist. But I'm talking here about the AHA and BHA.
Okay.
Alpha
The more
hydroxy-
exfoliating
Yeah,
ones.
the more exfoliating ones. So if you use the exfoliating agent like AHA, BHA, and also retinol actually.
Okay.
If you know in the market there's a retinol, and also if you want to be more advanced, there's a retinoic acid and tretinoin, but these two and adapalene, these three only can be prescribed by the doctors, of course.
Yeah.
So if you cannot, if you use all of these certain products and that doesn't work in 2 weeks or 28 days, because our skin's worst epidermal turnover is 28 days.
Okay.
It means it's not work.
Yeah.
You need to go to the doctors.
And they're not safe for pregnant women.
Yeah,
The
and
retinoid.
there is not safe for pregnant women. For the acid that's safe for pregnant women is only azelaic acid. If you can read the contents,
It's very soft.
azelaic acid, but it's very soft.
It doesn't sting.
It doesn't sting at all. But probably if you're pregnant, it's better you go to the doctor so you can have a safe pregnancy.
This is so complex to the point that there are several things that I did not think that the doctor was actually speaking in English. But look, those acid, if you are 30 plus, you might have been familiar with those agents. But later in the show, we will talk more about Milia, and we will talk also about how to get rid of it if the milia persisted. So do not go anywhere.